I gave him.
They didn't give me anything.
Because you're not here.
Okay.
You ready?
Mm-hmm.
Okay.
Okay, what is your full name?
My full name is Dr. Ayodoto Shuriba.
Okay, and where are you from?
I'm originally from Nigeria, but I'm now a naturalized citizen of the United States of America.
That's good. And what's your employment background and where do you work now?
My employment background, currently I'm a faculty with Texas Southern University. I'm an assistant professor, biology, and I have a pharmacy background as well. But I'm a full professor here. I mean, assistant professor here at Texas Southern University.
And how long have you been a professor at Texas Southern University?
Wow, it's been since 2006.
And how long have you been a pharmacist?
Oh, many years.
So what's your current title? Would you describe yourself as a pharmacist or as a professor?
Actually, professor, because that's what I'm doing.
Okay.
Again, let me clear that a pharmacist also is a professor.
Of medicine.
Even an MD can be a professor. So just because I'm going by professor doesn't mean that I should really leave the pharmacy.
Okay. And when you started as a pharmacist, what were your primary duties and responsibilities?
Well, I practiced pharmacy for maybe about 3-4 years. My duty to fill prescription. Actually, I practice in the form of retail pharmacy like CVS. That time I was working with Eckert's drugstore.
Oh.
That was a long time.
Yeah. Did they still have Eckert's around?
No,
Then,
the Eckert turned to CVS.
Okay. And did you know early in life what you wanted to do or what you wanted to be when you grew up?
To tell you the truth, I fell into where I am today by accident. When I graduated from University of Michigan, I was employed with Warner Lambert and Black Davis. And I was there working for many years. And what happened was I didn't get a promotion. So, from the grapevine, I was told that I didn't have a terminal degree. What do I mean by terminal degree? I didn't have a PhD. So as a result of that, all of the people who get started together, they are being promoted ahead of me. So that's why I went back to become a pharmacist. And then after doing that, I went into PhD by accident as well. So that's just the story of my life.
Okay. And so did you have any role models or somebody that helped influence you, or was it just
Oh
because of the
yes,
promotion?
oh yes. First of all, let's just start from they said charity begins at home. I have to let you know that my parents were they are enlightened people. You know, they pushed us, all of 6 of us, my siblings. They pushed all of us. And having said that, all of us have either doctorate or one way of professional degree as well. Then I have in academic side, Dr. Enigbokom was one of my mentors in the Pharmacology of Pharmacy. And he was one of the people that really pushed me. Then in my other side, Dr. Jaballa, who is not here, she was my mentor. Actually, I obtained my PhD from her. And also Dr. Fadulu. I have pretty much a lot of people that influenced me. Then upon all, I have a brother, the oldest of my family, that I, try to emulate. He has about 1,001 degrees, and I try to emulate him, and he's one of the people that really motivates me. I wish he can hear this interview. I guess his head will be swollen hearing it from me.
Okay, briefly describe your formal education. What kind of degrees or certifications have you earned?
Everything. Bachelor's, master's, family, PhDs. What else?
And did you have to take a communication course, like a speech class?
During the curriculum at that time, that wasn't required. See, certain years they revamped, changed the curriculum. When I was doing that, no, communication wasn't one of the main components of prerequisite to pharmacy.
So do you plan on continuing your formal education, on getting another degree, or are you
done? Practically done. My children, Well, you have to understand, it's a pressure of my children. Daddy has all of this, mommy has all of this. They have to do something. So it's a pressure on them. So let them do the rest.
So what most do you like about being a pharmacist? So what did you like most about working in pharmacy?
Well, basically, I don't take my job home. When I finish, it's done. Unless if I have a misfeel. And most of the time, it's hard for you to have a misfeel. So in this case, it's one of the good things, unlike being a doctor, a physician. I mean, they can call you for whatever it is. So I don't take my job.
Did you, or was communication, was it a big thing dealing in the pharmacy because you have to communicate
Oh,
with the contacts?
definitely. Definitely. There are a lot of times that a patient might be talking to you and you are in another zone. You see his or her lips flapping, but you don't hear that. And then they are telling you something and you are thinking of other things, depending on the mood or the situation of things. Yes, communication is very, very important. What about when you are getting the doctors calling in? You've got to be able to communicate well so that doctor will understand what you're saying. In the sense of, if the doctor thought is calling this and you are looking at the patient's profile to see that what he's calling has an adverse effect on the patient, you must have a communicating experience for you to be able to tell a physician that, you know what you are calling in, is not really good for this patient, blah, blah, blah. Because if you do that, you might have conflict of, and he might think you are arrogant and you are not complying to what the doctor is calling.
And did you ever have any conflict of communication, like a communication barrier?
Many times. I'm still having it now. I mean, I'm telling the students, do this, do that. At the end of the day, they are doing this. You said go to the right, they are going to the left. And I flunked them. So we still have communication problems.
So what would you say are your communication strengths and weaknesses?
Oh, I think I do explain myself, which you can tell from what you are recording. I think I do illustrate a lot of things. I do break things down so that people, even a layman, will be able to understand what I'm trying to say. But like I said, it's a the biggest challenge that anybody will have in pharmacy, in academia, in anything. Even as a professor, we can be talking to each other. Does that mean I'm hearing the person? Sometimes you might tune somebody, out of your system. They will just be talking and you tune. I do that to my wife when she's yapping her mouth. You need to cut that. Okay. You're the editor.
So what would you say is the best way to effectively communicate with your patients and the pharm techs in the pharmaceutical?
Actually, I think you should listen more.
Okay.
2, you should have patience. Patience is a virtue. By having a patience, you should be able to hear what other people are saying, especially when people are sick. They are anxious. They want their medication to be done at the right time. You've got to be able to understand that they're in pain. So you've got to be able to listen and try to put yourself in their shoes. At that time, you'll be able to communicate better.
Whenever you meet a communication challenge where you can't effectively communicate to the patient, what's your way of correcting it so you can let them know what's going on so they can understand it?
That's another problem that I have as a person. I have little patience for ignorance. And so I'm learning, and I'm still learning. Even with you as a student, I have to really bite my tongue sometimes. And many of the time, because
So did you ever use any kind of brochures or pamphlets to kind of better explain what you're talking about with the patient? Or did you just kind of do it verbally?
well, a lot of times when you constantly do something, it's going to be part of you. When you're doing it for years, months, and years, they're going to be part of you. And then as a result of that, you know when you miscommunicate. And a lot of times we do try to adjust and try to be nicer and be better on our skills. Communication is a skill. Communication is a big thing, big issues. Even within two countries, if you don't communicate well, there's going to be war.
Yeah.
Well, I don't know if you are still here when President Reagan was still, the president. And he was saying something to the president in Russia, you know, like there was a big wall that they constructed and he wanted them
to tear it down.
to
The
tear it
Berlin
down.
Wall.
Yes, Berlin Wall. And he said Gorbachev or something. The communication.
Mhm.
He might probably be saying this and they are thinking
Thinking another
other way.
way.
So that's how war can get started.
And would you say that gender plays any type of role in communication?
Oh, it might to some people, but to me, I don't think. Women are much more skillful with how they do things, and they can get on your skin as well. We can't look at gender as, you know, and a man can be as skillful like a woman as well. So I don't think gender plays a role.
And what about age?
Well, I will tell you this. People who are elderly, they have wisdom. And again, there are still some that their wisdom, they've thrown it away into the bathroom or something. It comes with wisdom. And a lot of times they will be skillful with the way they communicate. Yes.
And what about nonverbal communication? Does that play a role in the
Oh
field?
yeah, oh yeah. How many times as you, as a student with me, that I look at you like you are not listening, but you are listening. That is your posture, your body language is telling me this way, but you are feeling that way. And I'll give you an example. I have a postdoc in my lab, and we published a paper, and at the last minute when I was about to press the send, he said I should remove his name. And I was wondering, you what? You did all of this, you did all of that. And why are you opting out? What did I do? Did you hear something? Did you do something? And from the posture, I look at it like maybe he was anti-me. So until one time, by which I really removed his name, until sometimes this week, we sat down and I said, why don't you like me? He said, what are you talking about? I'm working in your lab, I'm doing this, and I don't still like you. What are you talking about? I'm like, because of this. He said, see, don't believe everything that you feel is a, what? It's a, don't believe it. Because they might be going that way, and the posture might be that way.
Okay, and how did you learn how to effectively communicate nonverbal communication? And how can you tell?
Non-verbal communication with me is just I smile. I just smile a lot, right? I smile a lot.
Okay. Well, do you have any final thoughts or any advice to give me going on?
My
into the health-
advice to give you
Yes.
as a young woman growing up is that listen, watch, and learn. That's the best advice I'll give you. Be patient. Be patient. Do not rush. Listen, watch, and learn. You're welcome. Come on. Wow, I love your nail polish.